cases on reimbursement are basically settled and paid for the members within around 5 to 6 working days. And it's definitely convenient because they cover all around the region. Moving into your table of benefits, this is only a summary. Please do download. I'm sure you've all received a member emailer that includes all the flyers, the table of benefits, the member handbook. So please always refer back to your detailed table of benefits. That's just a summary to give you a high-level details about your benefits. As you know, it's a yearly contract. So the policy started by 1st of April and it ends by March 2022. Your area of cover is worldwide, excluding USA for elective treatments. However, if you were in the US and you encounter any emergency or a life-threatening condition, then we definitely cover you in full. But that's purely for life-threatening conditions. Now, since we're an American company, we have to follow the OFAC sanctioned country list. So we do not cover any claims coming from Syria, North Korea, Cuba, Crimea, or Iran. As I said, the network name is comprehensive. I'm sure a lot of you would remember previously it was used to be called Tier 1, and that was when it was directly in-house. Now with Neuron, that's their highest network, which includes the comprehensive. Again, it includes the Cleveland Clinic, the American Hospital, and all the big names that are available in the UAE. Your annual limit have not changed. It's $1.75 million US. And definitely all pre-existing conditions are covered from day one with no restrictions. It's a medical history disregarded scheme. Moving into the inpatient, if you look at your detailed table of benefits, you'll find approximately a full page that gives you the details of the inpatient. I've just summarized it as paid in full because all medical costs, whether including the hospital accommodation, medical practitioners, nursing, appliances, you name it, anything that is related within an inpatient service is usually generally covered in full. Inpatients usually require a pre-approval where the hospital reaches out directly to us for an approval. So in a nutshell, inpatient are always covered in full. Your outpatient is also covered in full, but as you are aware, this year there's a 10% co-insurance that applies for all outpatient services. Historically, it used to be 20%. This year, it's reduced to 10%, which you need to pay to the provider before you leave. Physiotherapy is also covered in full. In full, you need to definitely be prescribed to be referred by a general practitioner, and usually after 4 to 5 sessions, we might need a progress report just to reapprove the following sessions by the doctor. But there is no limit on the number of sessions that are covered. Durable medical equipment, this is usually covered on reimbursement basis, and you're covered up to $5,000. That basically includes the buying and fitting of medically necessary devices like spinal supports, orthopedic braces, aircast boots. If someone needs to rent or purchase crutches or wheelchairs, this is where it falls. Other things I can think of are the external prostheses. If someone requires artificial eyes or limbs, this is where it is covered. You're covered up to $5,000. If you look into the detailed table of benefits, you will find more details on it. It will tell you per external prosthesis, it cannot be more than $4,000. It has the breakdown, but as a benefit, you're covered up to $5,000, and this is usually on reimbursement basis. Moving into the complementary medicine, you're covered up to $1,000, and that includes the podiatry, osteopath, chiropractic, traditional Chinese medicine, acupuncture, homeopath, and so on. This used to always be purely on reimbursement basis when the policy was in-house with us. Now, if you look into the network list of Neuron, you will see that, for example, chiropractic, you can find providers that accept chiropractic on direct billing. So that's also a plus thing with Neuron. Pregnancy and childcare, you're covered up to $10,000 for delivery, while outpatient is covered in full. Again, if we look into the table of benefits, it will tell you that the OP is covered in full, but it covers 12 routine antenatal checkups, 3 routine TD ultrasound scans. So you need to go back to your table of benefits just to see what's the breakdown. But in general, the OP is generally covered in full, while the deliveries are limited to $10,000. However, for the cost of a medically necessary C-section, we'll uplift the cap and we cover it in full. But that's purely for medical necessity and not for any elective C-section. Moving into the dental services, we have added this benefit for you this year. You're covered up to $1,000 with a 25% co-insurance. And we have offered all our 4 dental modules. So you have the routine, the major restorative, the orthodontics and implants. Again, all the breakdowns are there on the table of benefits. If you want a brief summary of the services, so under the routine, I can think of the cleaning and polishing, the composite fillings, the x-rays, the simple non-surgical extractions. If we look into the major restorative, you'll have the root canal and the surgical extractions. Orthodontics, we're all familiar with orthodontics, and then you have the implants. But even if someone requires some to repair a crown or a bridges or dentures, those are also all covered under the dental benefit limit. This used to also be on reimbursement basis. If you look at the Neuron list, you'll have a lot of providers that actually accept dental services on direct billing. So I genuinely advise everyone to look into the network, especially for this benefit, because if you go on direct billing within the contracted providers of Neuron, you'll benefit from the discounted rates of Neuron and therefore can manage to use it more than actually paying as a private patient. Moving into the optical, we've covered $100 with a 20% co-insurance, and that's purely for the cost of lenses, spectacles, or the frames. So this is also covered, but that's on a reimbursement basis. Mental health is covered up to $5,000. That's for the psychiatric treatment and psychotherapy, but that's for elective outpatient services. If it's following an inpatient or during a stay in a provider, that is not covered. That has a completely different benefit. That's purely for outpatient sessions. Vaccinations are covered in full, whether it's the travel vaccine or a flu vaccine, all sorts of vaccinations are covered in full. Evacuation is covered in full. Again, I would advise you to check the table of benefits because it has a full pager that explains all the benefits of the evacuation. It also transports you from, it gives you the airline ticket, a companion, someone to accompany you throughout the evacuation. But in a nutshell, that means to basically transport you to the nearest appropriate medical facility where they have the treatment that is required. But in addition to that, there are a lot of extra benefits that would cover someone that is accompanying you or the tickets on it. Mortal remains is also covered in full, and that's basically if someone, God forbid, dies outside their home country, basically we transport the body back home, or we cover for the burial or cremation costs. That is what it means. Compassionate emergency visit. People who were insured with us earlier know that we cover 1 economy class return ticket if you are to visit your close family member. Please reach out to the table of benefits or the member handbook to just see the definition of a close family member. It's very, very extensive, but there are a specific terminology on who is covered, who we consider under a close family member. So you're entitled for this on reimbursement basis if you are to visit a close family member if they are diagnosed with a critical illness, or God forbid, if someone passed away of a close family member and you would need to attend their burial or cremation following their death. That's again on a reimbursement basis, and to avail this benefit, we would need some extra documentation other than the standard list of documents. For example, a proof of a relationship, a proof of traveling, a few documents that I'm sure you're aware of. Before I go into the claiming procedure, do you guys have any questions about the benefits? Dalia, please help me if there's any questions in the chat box. I don't have access to the chat box. I can't see it.
I'm just checking. No, we don't have any questions written on the chat box. Does anybody have any question to ask? If you'd like to speak up, or if you want to type it on the chat box to the right.
And we'll keep the last.
This is Javed here.
Hi.
is there any procedure to add our dependents in the same insurance?
Yes, but if you don't mind, I would need to refer you back to your HR and NASCO to answer your question. But yes, but all you'll have to discuss it with your HR, please.
Thank you.
Thank you. You're welcome.
Okay, we have a question. Rana, PCR test cost is covered. They're asking about the PCR test.
Yes, we do cover PCR tests, but there are specific conditions. So it's condition.
This we're just reviewing final what we
Mr. Kumar, I would kindly request you to put your.
He's not still seen that quote. Today morning also he spoke.
Okay, let me.
Sorry, I think he missed muting himself.
Yeah. Okay, so we're talking about the PCR test, Rana.
Yes, so the PCR is, we do cover PCR tests, but there are specific conditions. So condition number one, you need to have symptoms. So as simple as the GP or the doctor you visit mentions that you do have flu-like symptoms, as simple as cold or a cough or a fever, that would work. The second condition would be that it needs to be a known medical facility, which we're all aware of, whether it's Siha or those through providers. So it needs to be approved by DHA. And you just, those are the only two conditions, and we do cover it. If someone is diagnosed with if someone is positive, then the treatment is definitely fully covered. However, if someone has been in contact with a positive case, but they do not have any symptoms, then we don't cover it.
Okay, I hope we answered you, Stanley. I have a few more questions coming in. Okay, the next from Aziz. Do we have over-the-counter medicine covered through pharmacy?
Yes, but you need to be referred, obviously. You need to have a prescription.
Consultation, yes. You need first to go to the doctor, and then they will prescribe the medication, and after that you can collect it from the pharmacy.
That's a very good question, because I'll cover it throughout my discussion on V-Health services and how you can benefit from V-Health. But for now, my answer would be you need a prescription to have the medication dispensed.
Okay. Next question from Rohit. Is Aster covered in direct billing?
Yes, it is. Yes, it is.
Okay. Next question from Yasmin. Is alternative medicine covered?
Yes, and we covered it a while back under this slide, which is called the complementary medicine. So some people call it alternative, we call it complementary medicine. It's the last one on this slide. Those are all the benefits that are covered, and you're covered up to $1,000.
Thank you, yes, Rana. Okay, next question is from Fatah Khan. List of hospitals covered in India. We can definitely share that with you or with the HR after the call, and then they can circulate the same to their staff.
Yes, and just for your reference in future, we have a few slides about our member portal. I'll tell you exactly how to register, since this year we'll have to do a new registration under Neuron. But it's very easy to generate a list of contracted providers in a specific country. You just need to put the country, India, and then the city, and it generates a full Excel file with all the providers that are contracted.
Okay, if you can share that with us, Rana, we will also circulate it to the HR, both DICAN and AEF.
Sure, absolutely.
Okay, next question is from Burak. Do we need practitioner referral for physiotherapy?
Yes, you do. But again, you can use it through V-Health services. I personally get a referral just from V-Health without me needing to go to the provider, but it also depends on your case. But to answer your question, yes, you need to be referred. We do not limit it to a number of sessions, but it requires referral. And in most cases, we would approve a number of limited sessions. And after you finish or you consume all those limits, we would need a progress report from the treating doctor to reapprove a number of sessions further.
Okay, like a progress report, I would say.
Absolutely.
Okay. Next question from Hussein. What is required for COVID treatment reimbursement done outside UAE? If the patient is home quarantined, is it fully covered or 10% co-insurance would apply? So Hussein, your question might be a little bit not clear. So the person was diagnosed with COVID-19 and he is currently at home. Is that your question? If you can just rephrase it for us to better understand and try to give a
Yes.
clearer answer.
Hi. Yeah, hi. Yeah,
Hello,
so
hi.
the patient is outside of UAE and he has been diagnosed with COVID and home quarantining and taking doctor's advice accordingly.
Yeah, but what services are you looking at here? When someone is, what we cover
So-
is if someone is admitted to the hospital and is quarantining in the hospital. So those
Yeah,
charges. Yes.
Yeah, so basically doctor advises to go for RT-PCR test or CT scan or requests for blood tests. So that's what basically I'm referring to.
Those are by default,
So the
whether the
patient
member is. Yeah, sorry, the voice is a bit cutting. But regardless if it's COVID or not, again, if you have a specific case, we can definitely review it with medical team. But a simple answer from my side is if someone is required or prescribed to do a blood test or whatever sort of test, whether he is positive or nothing related to COVID, we do cover it under the medical insurance policy, as long as it's referred.
Okay,
Now,
because
the
the thing is like the patient was having video calls with the doctor. So there are no basically papers like as what we have we call it as prescriptions. So it was a teleconsultation or a video consultation every time on a alternate basis, or alternate day basis.
But I would assume, again, each country has its own regulations, and specifically because of COVID and all the new changes in rules, and each country is like following different practices. Maybe I'm not the perfect person to answer your question, but I would assume, again, I don't know what's happening back in India. I need to share it with my experts, the medical team. But I would assume even if there was a video teleconsultation, or there should be followed by reports. And that's exactly what we do with vHealth. Now, when I reach to the vHealth, this is all teleconsultation services, whether by phone or by video chat, but everything is followed up by medical reports, referral notes from our end into the app. So I would assume this is what should be followed as a practice in India. But again, I'm not the right person to answer you on spot. If you can just share with us or with NASCO details on the case, we're happy to review it by the medical team.
Sure. Okay. Thank you.
Thank you, Hassan.
Well, yeah, shall we proceed with the presentation and then keep maybe possibly the questions till the end?
Okay. I have a few more questions. Actually, so many questions are coming. So let's keep the questions all at the end. We stopped at Osama Fikri, so we'll come back to him. Yes, go ahead, Rana.
Thanks. So moving into the claiming procedure, I won't spend so much time on that, but that just tells you how to use our services, whether you go for inpatient, outpatient, or within the network versus outside the network. So for outpatient, those are for the simple normal visits to the provider. So within the network, that means that they are contracted with us. You just present the card or the Emirates ID. You just pay your share of deductible or co-insurance, and we take care of the rest. Now, usually any service, any one single service that costs below $500 or 1,800 dirhams does not require a pre-approval. Let's assume that a visit would cost more than this amount, then the provider would send us a request. But we generally see most of the services are below, single services are below this amount. So if a doctor, usually even people diagnosed with chronic conditions, we tend to see doctors prescribing for 3-month supply of medication. But in case they're prescribed for more, we have no issues with it, but it needs to come for AETNA or Neuron for approval. Okay, so the new contact numbers under the Neuron is 800 My AETNA. You'll find it on on your card, on your e-card. You'll find all the details. Please forget about the previous toll-free numbers. We've migrated now to a Neuron. There's a specialized team that is just looking after Daikin and other clients. So if you decide to go outside the network for inpatient services, this is when you need to pay. There's no direct billing facility between us and the provider. You just need to pay and then get all the documents and file for a reimbursement. You have one of two options for claims reimbursement, either, which is definitely highly recommended, is where you submit the claim on our portal, on the e-portal, which is neuron.ae/AETNA. So whoever had a previous profile with us needs to quickly just register a new one under the Neuron AETNA platform. So if you submit your claim online, you would not need to submit the original claims form, because you will it will pre-populate some questions which you would answer with a yes or a no, or if it's a dental service or not, and it populates a claim form. Yeah, so it's much easier. Second option, for whoever wishes, you can definitely email us. But then we would require the actual claims form and all supporting documents. You have 6 months to submit a claim after a treatment, like from the date of treatment. You have 6 months to submit it. Any claims that exceed the 6 months will unfortunately be denied from our end. And as I said, what we say that Neuron requires a maximum of 10 working days to reimburse or to finalize a claim, while most of the cases you will, especially the simple and the straightforward cases where you have submitted all required documents from the first go, you will see yourself getting reimbursed in around 5 working days. Moving to inpatient, this is where you're required to do basically operations, and this requires a GOP or a pre-approval from our end. Usually within the contracted providers, especially in the UAE, the providers, the hospitals send us directly the request, which we assess and approve. If you were outside the country and required to do any surgery, even if they're not contracted, what I would advise you to do is to reach out to NASCO or ourselves. We might be able to put a guarantee of payment with the hospital, even if they're not contracted. That in a lot of cases it works. We'll try our best to support you. And the details of AETNA Neuron are the exact same ones, 800 MyAETNA, and the email address is myetna@neuron.com, as in cases of inpatient. Now, moving into the member portal, it's very easy to use. You can access it through any device, whether it's a tablet, laptop, desktop, mobile, you name it. And this is where you can basically view all your benefits, the member handbook, even the COI, your certificate of insurance is attached there. All the flyers like the V-Health services, the EAP, the Red 24 services, all those have their flyers attached. That gives you all the details on how to basically download their individual respective apps and so on. You can file a claim there. If you are looking at for a specific doctor or a provider, you can locate all your doctors and hospitals and generate network lists from this portal. Okay, so the website is, as I said, neuron.ae/AETNA. You register by either putting your member ID or your Emirates ID. Previously, if you recall, we used to open the portal through our name and email addresses because we've had a couple of issues with tagging names. So now it's based on your unified Emirates ID or your member ID number. Okay, so you just put it there and you'll find everything attached based on your own profile. Now, moving into, yes, we do cover, you have a very extensive table of benefits that covers you for medical services. But other than the medical services we offer, we care a lot about the well-being of our insured members. So the next few slides gives you a couple of those extra added or value-added benefits that we offer you. First of all, I would talk about the care team. This is basically a team of clinicians that are working for AETNA. They help members get the right care at the right place and time, I would say. As I said, they are experienced clinicians. They handle pre-trip planning, personalized care, maternity case management programs, prescribe medication, or give you access to medical evacuation and discharge planning. So basically, they personalize that one-on-one member experience. For members who are diagnosed with chronic diseases, they basically help you achieve, I would say, the highest level of health while by either putting you into smoking cessation programs, by giving you some programs about mindful eating, health first, wellness challenges. I'm sure you recall we used to do a lot, us and NASCO used to do a lot of in-house events and webinars and all those challenges. But unfortunately, due to the current circumstances, everything is shifting towards virtual events nowadays. But yes, just to give you an idea about this team of specialized clinicians. If someone requires a second medical opinion, as simple as a second medical opinion, you can always reach out to us. We'll assign a specific case manager that looks into your case and give you their own opinion about the case, or they'll have their ways to help you with your medical condition. Moving into, that's my favorite, the V-Health. I'm sure you recall, we've done a lot of events on V-Health. In your last year, you were insured with us. This is, in simple words, the primary care concierge services. This is where we stand out in the market, and we know that this service is designed to take care of you, not only you, even your dependents' primary care needs, whether in the morning, at night, whether you're in the office, at home, whenever you need it, you just download the V-Health app. It's V-Health Dubai. Just make sure that you download the right app, because each location has their own application. If you have a specific medical need, or you just want a second medical opinion, the doctors, you can always arrange for a call for the other day, for example, at 9 a.m. with a V-Health doctor. The doctor will call you on spot at exactly the same time. You will get a text message 15 minutes before the appointment to remind you. In advance, when you book it, you will see, if you put your email addresses, they will send you a meeting invite on your email to remind you. Those are definitely registered within the HA, and those doctors are not incentivized. So we tend sometimes to see when we go to hospitals, the doctors, you feel that they are incentivized. They do have actual targets to fulfill in the number of patients they see, in the number of tests they prescribe. Those doctors are purely unincentivized. Proper primary care that they offer. It's a very convenient process. As I told you, you schedule a doctor appointment, the GP will call you. They will conduct a very thorough assessment of your condition. If you require additional tests, blood, urine, blood tests, they will arrange for a lab to come to your workplace or to your home and take those samples from your convenience. Where you can be sitting at Daikin's offices, they come and take the blood test, or at your place. If in case you require medication, they will prescribe and they deliver it again to your doorstep, whether you're at home or the office. If with all this, you still need to see a specialist, then you have the full right to go wherever you need. They can also help you if your doctor, if your specialist, which you're comfortable with, is in City Hospital. There are people that are called V-Healthers, the admin staff of V-Health, that can actually speak to City Hospital and arrange that consultation for you. It's that convenient. I personally always use it. Even for whoever asked me about physiotherapy, as you rightly said, that you require a referral. And if you do not want to go to the provider to see a GP just because you know your medical condition and you need a referral for physio, you can just call V-Health. They can do the assessment. If the condition is not major that would require you to go and see a specialist, they would prescribe refer you to physiotherapy on the app. After you finish, they're going to send you, or they will attach on your app the after consultation notes, which requires which includes the referral. That referral, you can as simple as email it to the provider and just go and start your sessions. Obviously, with V-Health, there are no consultation fees. So the 10% you would have paid if you are to go to City Hospital, Simal, Habib, Aster, or you name it, will not be paid through V-Health services. Again, we highly recommend it. Please do use it. We as AETNA staff use it a lot. Definitely, if you feel you have a complicated case or a serious condition, we would advise you to go see the experts. but for simple or GP services, vHealth is more than convenient. This is the app, as I said, you just need to download it. You can even put, for example, if someone has like skin rash, there is a place where you can, before the appointment, while booking the appointment, you can take photos and upload them. You can put a summary of the condition or the call just for the doctor or the GP to know, to have heads up on the condition. Please try it, just scroll through it, download it and scroll through it. You'll be impressed with the amount of services they can offer. Moving into the EAP, and that's basically that's not AETNA. We're contracted or we're partnering with a company in the US called Workplace Options that offers counseling sessions. We are all juggling work life and work and between our work and life, and sometimes to find the right balance might be extremely challenging. We all go through our ups and downs. So if someone needs any childcare support or finding financial or legal advice, or God forbid have lost a dear family member and is going through a stressful period of time, this is when you use EAP. You download the app. On the flyer on the website, it will tell you the exact app you download. You can either have on the phone sessions, you can email them, or sometimes you can have live sessions. Please use them. This is nothing related to medical services. That's just an extra service or support when it comes to counseling to help you with the anxieties, people suffering from depression, stress, and stuff like that. The last one I would say is the on-ground emergency services. So that's in cases of natural disasters, kidnapping, political and social unrest, or terrorist attacks. This is when World Aware will kick in and evacuate you to the nearest or the safest place. That's not AETNA. We're contracting through a third-party administrator that offers this service. This is also based abroad, but we do offer it. I know nowadays most of us are not traveling abroad. We're just staying around, but this service is also offered from our end as an extra service. Now, as I said, those are the contact details. You'll find them on your card, the email address, the toll-free number. In cases of emergency, when you speak to us, you press on option 1. It takes you to the team that manages emergency and evacuations. If you require any pre-approval or a direct billing approval, you please choose option 2. And just in case you just want a normal question or a follow-up, if you want to speak to our member services team, then it's option 3. Before we take into the questions, I will just hand it over to the NASCO team to conclude it. Dalia and Rima, over to you.
So, hi everyone, I am Rima. I'm sure most of you have already been in touch with me as you've been insured with through NASCO for many years now. Our role as NASCO, being your broker, is to assist you whenever you require an answer to your questions, whether be it a benefit, an exclusion. We can guide you through the process. If you've been to a provider and you have a rejection from AETNA, you're not sure what is the reason, or you want to expedite an approval where you need to do the treatment as soon as possible, you can always reach out to us. In the next slide, you will see my contact details and email ID. Please do reach out whenever you require help, as you always do, and let us know your feedback on the policy with AETNA.
Thank you, Rima.
Back to you, Rana.
Thank you, Rima. So this is basically in a nutshell. Again, we're happy to have you back. I hope it's going to be a smooth policy year. As Rima and Dalia said, we're all there to support you. We're one phone call away. Whether you reach out directly to our member services team or you seek your consultant NASCO's support, we're all there to help you. Dalia, would you like to proceed with the questions, please?
Yes. Okay. So we're back to questions. We stopped at Mr. Osama. he was asking regarding the PCR, if the person has symptoms, I believe he won't be allowed to see a doctor before he gets the PCR test done. So how it works in this case?
No, if I go, for example, just for I book a PCR and just go do the test, that is not covered unless I just go check with a physician or a doctor because I have symptoms and I feel that I might be having the COVID and the doctor agrees and refers me, the test would not be covered. It would be considered elective.
Yes. So basically, Osama, I believe voluntarily going to do the PCR test on your own will not be covered. However, if you have symptoms, you will probably have to see a doctor first to check the symptoms, to do the consultation, and then he is going to schedule you for the PCR test. I believe, Rana, this is usually the process how it goes.
Absolutely. Okay. So if I just book on Siha app and just go do a COVID test, that is voluntary and it's not covered. But a lot of cases are being referred by their treating doctors, and those can be covered if they fulfill the requirements I have mentioned.
Correct. Okay. Next question is from Abbasi. So childbirth delivery cost, whether it is normal or C-section, is it covered in full or not? Whether it's emergency or non-emergency, kindly clarify.
Okay, so in cases of delivery, the delivery itself is covered up to $10,000. If a medical necessity, if a C-section needs to be done based on a medical necessity, then we do not cover, we do not limit it. So it's covered up to policy limit, right? But if I electively want to deliver through C-section, that's limited to $10,000. For normal deliveries, it's $10,000.
Okay. Next question from Rajaram. Is it covered for Ayurvedic? And I believe Ayurvedic is part of the complementary treatment, Rana?
Yes, it is covered. Let me just open the slide. Sorry, I need to go on. It's covered up to, I think we said $1,000, if I remember the limit correctly. Yes, up to $1,000.
Okay, great. Next question from Divarajan. Is there any limit on eye treatment? So I think eye treatment here, Divarajan, if you allow me, Rana, we have two arms. Either we're talking about optical treatment, which means the glasses, the lenses, that would have a sublimit. However, if we're talking about normal visit to the ophthalmologist, because maybe the person is suffering from redness, irritation, inflammation in the eye, that would fall under the outpatient treatment.
Absolutely. Exactly. So basically the limit of $100, which we've mentioned, is purely for the contact lenses and the spectacles. Now, laser or correction of eyesight is not covered. That's a general exclusion. But as you rightly said, Dalia, all the other services or the treatments are covered within the policy limits.
Great. Thank you, Rana. Okay, next question from Roshan. Is herbal medicines covered? So I think herbal medicines more into, could be cough syrups, they would be herbal, not the alternative medicine.
Yes. So if someone had a cold and flu, for example, and went to the doctor and they provided those herbal medication, that on the system-wise will be denied. That's for sure. But if that same medication was paid by the member and they submitted, then most probably it will be covered under the complementary medicine. But as a pure drug and dressing based on the normal outpatient limit, no, those herbal medications are not covered. But since you have the complementary medicine, most probably it will, it depends on the medicine you purchase, but most probably it will be covered under this specific limit, $1,000.
Okay, clear. Next question from Gauss Pasha. For children, some medicines are not covered. We are paying full amount for that. Is there any procedure to reimburse?
Again, it's very hard to answer such a question. It all depends on the case, on the medication. So unless we have a medical report or not even a medical report, we know what's the case and the medication itself. I think it's going to be very hard for me to answer a yes or a no. But what I would advise is the member to share the details of the case, and we look into that specific medication.
Correct. Mr. Gauss, you can absolutely raise this to the HR or to RIMA for claims in case you have any medicine that was not covered. Probably you need to give us more details for us to help you on that. Next question from Aftab. Are multivitamins, probiotics, along with medicine prescribed by doctor are covered or not?
Sorry, come again, Dalia. Probiotics and what was the first one?
Multivitamins.
Probiotics, no, it's not covered. It's usually not covered. Now, multivitamins, again, it depends on the condition and if you have any deficiencies. But general, again, it all depends on the condition. If someone is pregnant or if it's a normal me, just going to the pharmacy and trying to get multivitamins. It all depends. But in a simple answer, I would say vitamins are only covered if in cases of deficiencies. Proved deficiencies, but probiotics are generally not covered.
Okay, clear. Next question from Jude. What are the specialties, for example, derma or dental, that are not covered in the insurance?
Sorry, Dalia, your voice is cutting. Sorry,
Okay.
Can you repeat it one more time?
Can you hear me now?
Yeah, I can.
Okay, so Jude is asking about the specialties that are not covered in the insurance. She gave an example of derma and dental.
I can't think of anything that is not covered other than a plastic surgeon, for example, but dermatology is definitely covered. Dentistry is covered. Now, dental is covered under your plan because your HR has purchased a dental benefit, but for someone who does not have a client that does not have dental, then no, they're not entitled. So it depends on the services, but as a specialty in the hospital, no, there's nothing that is not covered if it's not cosmetic or if it's not a general exclusion.
Exactly. I think the question was raised because a lot of dermatologists are covered, so probably that's why the question was raised. Maybe, Jude, what we can try to do is we can share the list of exclusions in general that are applied under the policy. That probably would give you some heads up on what is not covered under the insurance. But for now, it's a very comprehensive plan that probably includes everything required. Next question from Rushan. What about dermatological skincare products and treatment? Is it covered?
Again, now we're going into very specific cases. So I'm not a medical person at the end of the day. All those needs to be reviewed by a case manager or a medical person that looks into cases. But yes, a lot of the skin conditions or diseases are covered. But again, it depends on how the case is, how it is assessed by the doctors. If it's something for cosmetic reasons or for it's not medically required or for whatever other reason that is not medically necessary, then no, it's not covered. But those now we're going into very generic questions that even a medical person, if he does not have the documents in front of him, it's very hard for him to confirm a yes or a no.
Yes.
Let me... Sorry, allow me to intervene here. For Roshan, if you mean by dermatological skincare products, as in the moisturizers and the face creams or the body lotions that you buy from the pharmacy, those no will not be covered. So anything that does not have an active ingredient and it's a pharmaceutical item, it will not be covered. As a general rule, all the cosmetic skin products will not be covered. The creams that has antibiotic and the type of creams that are actually pharmaceutical products will be covered.
Great, thank you, Rima. Okay, next question from Jad. Are teeth whitening, root canal, jacket including zirconia crown covered with 25% copay? I think we have probably to go to the dental slide, Rana, just to take the members through what is exactly covered under the dental.
The coverages are not specifically mentioned. They're mentioned on the table of benefits, but I can actually read them out. Teeth whitening, if I'm saying whitening, no, it's not covered. That's a cosmetic benefit, but scaling and polishing, for example, is there. Cleaning is there. But whitening, if we refer as a whitening of teeth, that's purely cosmetic. That none of the medical insurance providers, I would assume, would be covering for it. Let me just check for you the, what was the second part of it?
Root
Crown.
canal and crown.
Root canal is definitely covered, crown is covered. Now, to be very honest, again, to the specifics he's mentioned about the zirconic thing, I'm not the right person. It needs to be referred to a dentist, but crowns are, yes, covered.
Okay, great. Next question from Mayan. Are you covering routine vaccinations at home for children? Some of the medical facilities do provide vaccine at home service. Do you cover the extra charges for routine vaccinations at home?
Routine vaccinations are covered now at home. The first question that would come to my mind, are those DHA approved? Not to my knowledge that they're being covered in home, to be very honest, but I'm happy to ask the team. But yes, vaccinations, routine vaccinations are covered. The aspect of covered at home, I'm not aware of any approved DHA providers that do them at home, to be very honest.
So Mayan, it is maybe preferable if you can discuss this with the HR. Maybe they can give us the name of the clinic. We would check that within the network and whether this service is there or not. But when it comes to the vaccination in terms of benefit, yes, it is there for children. Another question from the same person, Mayan, are supplements such as vitamin D covered for children if prescribed by a doctor? I think this takes us back to the same question that was raised earlier about the multivitamins. If there are deficiencies, then it would be covered.
Yes, absolutely. That's the right answer, Dalia.
Okay, next question from Prasad. Are food allergy tests, especially gluten and dairy allergies, covered in the policy?
No, those are not covered. Those are experimental and they generally are part of the exclusion list.
Okay, next question from Adji. Please, do you have any direct billing hospital and pharmacy in Ivory Coast?
We do have, I believe, again, we need to check it from the portal. We do have in Ivory Coast, I don't think it's a very extensive list of providers, but yes, there should be. Now, the pharmacies might be on reimbursement basis, but for in cases of inpatient, there is a list of providers, yes.
Okay, great. We will again share with the HR the link for the members to be able to search outside the UAE when they type in the country name so that they can get the list in Excel form. We have another question by Faith. Application information to download, and can we sign up using Emirates ID?
Sorry, can you repeat it, Dalia, please?
The application information to download, the AETNA application, and can we sign up using the Emirates ID?
Are we talking about the portal, the AETNA Neuron portal, not the vHealth, right? Yes, you can either, if you're talking about the portal, it's a website, and yes, you can either register through your Emirates ID or your unified card number.
Okay, great. Last question from Algada. In order to register using the vHealth app, it requires member ID to be filled in. Physical AETNA cards already available with the Darkin HR? Not yet, Algada. We're still working on those physical cards. But you can definitely refer to the HR if you need help with your member ID number.
To register, she's talking about the vHealth, right?
Yeah.
Yeah, I'm sure you have at least your card number, so you can just register or through your Emirates ID, register on our member portal, the AETNA Neuron member portal, and there's a tab where you can generate the actual e-card. So you can save the e-card from our member portal itself. It will have all your details.
Okay, next question from Gampat. In India, if hospital is not in the list, what is the procedure for claims?
If someone requires to do a surgery in India and it's not covered, as I said, try to reach out to us and NASCO. From both the parties, we'll try to convince the hospital to place a GOP. That's not I'm not guaranteeing that will be covered, but we will try to have that extra mile. If not, or for regular outpatient services, then the members can pay and then file a claims reimbursement on the app, on the portal, sorry.
Okay, thank you, Rana. Another question from Abbasi. If my family member details are not showing on my profile on AETNA website, how to add it? I believe, Abbasi, if you're talking about your wife or children above the age of 18, they would have to do the registration on their own.
That's correct. That's correct, Dalia. And if not, if the kids are young, below the age of 18, and they're not showing, you need to confirm if they are included in the medical insurance scheme or not, because it should be linked directly.
Okay, next question from Tom. Is it a different registration for the Neuron application than the member portal on the website, or is it using the same credentials?
Sorry, it's not clear. Between the what are we?
Neuron application and the member portal.
It's the same one. It's the same one. It's a linked. It's a customized platform between us and Neuron. So Neuron has other insurance companies that they serve. They have completely different offerings and websites. The one for AETNA is neuron.ae/AETNA. So that's a linked system between us and Neuron.
Okay.
So there's only one platform to be used, which is neuron.ae/AETNA.
Okay, clear. Any more questions? We're done with the questions on the chat box. Anybody wants to add anything or clarification or a question?
I think we're running over time. Sorry, apologies. We have booked members for 1 hour.
Okay, we have a nice question here from Chandran. Is plastic surgery like nose job, rhinoplasty covered by the insurance?
I think my answer would be I wish, but it isn't.
Exactly. I would have signed up for this myself. No, it's not covered, Chandran.
Are we good to, do we have anything else or can we conclude it?
Is there any arrangement for COVID second dose vaccine and how long we can delay it? This is a question from Gauss. I'm not sure, Gauss, if this is related to AETNA or if this is an initiative done by DICAN HR. Probably you might need to just raise it to them so they can help you with that. Okay, Shibna, if you are on board, are we good? I've shared with you the presentation material as well, and for sure I will be sharing with you some meeting notes on the common questions that were raised in the meeting. Just let me know if there is anything else you would like to highlight.
Yeah, thank you, Dalia, Rana, and Rima. It's a nice presentation, and yeah, please send, even if you have that recorded version, please send to us, and we will share with the members.
Absolutely, absolutely.
Thank you so much, everyone. Thank you for joining.
Thank you, everyone. Thank you. Have a great day.
Bye-bye. Thank you. Bye.
Bye.